their loved ones, who cares about them, who they care about, their community, and working out how these two things work together. Here is some example of some successful public policy that can be used. This is an example in Nepal. It's a very moving image of a child, how it could disturb the development of a child. And on the right, you'll see Malaysia talking about how someone could save for a car or a house, or the money they're costing, and health-related issues if they don't quit. This is some of the government campaigns in Australia. The National Tobacco Campaign's been going on for a long time now, TV, social media, and you'll see here, you've probably seen this if you're an Australian, after 5 days, nicotine's out of the body. After a week, smell and taste improves. After 12 hours, the carbon monoxide is out. You're starting to reoxygenate. Over a year, you see on one of the latest ones, you've saved nearly $14,000 if you've given up. And then obviously risks of different lung and cardiovascular illnesses go down. This is further data from the Australian government about trying to deep breathe, hydrate, delaying the craving, looking at nicotine replacement, contacting quit lines, psychotherapy. And nicotine replacement is a big thing. Healthcare professionals can also assist and be trained. There's a 5-step method that they encourage, which is to ask the client or patient, do they consume tobacco, assess how bad their dependence is, advise them that quitting is in their best interest because it's better for them and their family and public health, and basically give them the assistance to do that, and then follow up. And obviously the credibility of a healthcare professional can help a lot. This is some of the nicotine replacement products that are available. In Australia, you've got the Quitline hotline, you've got a Quitline app, and you've got a calendar that can help. So these are some resources that can help people. This is a campaign that we were looking at doing, which is basically about saying yes to what's good for you, no to what's wrong, and encouraging people that clean air is the most basic human right, that essentially air should be clean, safe to breathe all year round, and that by minimising tobacco, you're avoiding death, disease, and disability. And we plan to back this up with benefits, risks, statistics, and different measurements. This is some examples of a marketing campaign that we can run that's just taken from various places on the internet, like Pinterest and things, which is encouraging people to hydrate, to eat healthier, to save money, to minimise alcohol, and being aware of the cardiovascular of the lung and some of the brain damage that they can do with themselves when they're lowering the oxygen with some of these dangerous chemicals. In order to initiate a public policy campaign like we proposed, there's 6 steps of a project life cycle. You initiate it, you think it through, you do it, and then you optimize it and you measure. So this is an example of the World Health Organization, and they've got 6 pillars internationally, where they're enforcing bans, they're offering people to help quit, they're monitoring, they're raising tax and so forth. A 3-step plan would be the prevention of tobacco use, treatment, early intervention, and involving people in decision makings, working together and quantifying improvement. That initial stage of planning, you'll see vital strategies, which is planning research on the individual's belief systems, attitudes, audience, assessing the impact, and really engaging the community, which is at the level of individuals, families, groups, and governments. And you'll see really surveying people initially to know where they're at financially, in their health, socially, and with their self-perception. And then one policy that we would like to implement would be an early implementation of 18 to 45-year-olds, the younger market that might be targeted with vaping. You'll see here, this is one study that showed that in this instance, men were very associated to quit. So we thought we'd be aware that men could be a market that could be targeted for the sake of their family and others. And that young people showed in one study that if they hadn't smoked for very long, they were still associated to want to quit. So that's 2 subgroups that may need help. This is a 12-month overall plan. The first thing we would do in this policy would be to submit a pre-survey, put educational materials where people work, live, and have their recreation, deliver to healthcare professionals in the various communities the 5 A's, and show people those 3 options: contacting quit lines, nicotine patches, psychotherapies, and also educating families of withdrawal symptoms, and then getting feedback from those surveys, implementing these strategies, narrowing down on what works, getting rid of what doesn't, and then after 12 months ceasing, reevaluating and reassessing where to from there. You'll see that some of the campaigns could contain things like vaping affects your health now and in the future, getting testimonials from very healthcare professionals, question answers with those in the know, and really trying to create incentives for younger people, fitness memberships, gift cards, looking good in public, and leveraging healthcare professionals to use that perceived credibility to educate people that this behaviour is not in their health interest. This is our proposed policy. So you'll see this is unique to us. Look at the individual, the family, the group, and the government. Encourage the use of quit lines. Raise awareness of the nicotine replacement patch. Look at various psychotherapy type interventions, and educate people on the dangers to themselves and others, and also encourage them to get help. Raising awareness with the family members, empowering the healthcare professionals with the 5 A's and other frameworks, and also empowering governmental departments. You'll see here some other awareness points that we can run local and various media campaigns. You'll see that governments should be encouraged to have appropriate capacity in their facilities to help people. Local businesses should be encouraged to have smoke-free workplace, smoke-free areas in homes, particularly for children. Strip the positive associations for young people to smoking, understand that it is a danger to their health, and target thresholds, households of those that smoke to stop the children following the patterns of the parents and the grandchildren, and then targeting these vulnerable populations for proper positive education, those with mental health issues, youth, Indigenous people, about the dangers, and also target those that may be cross-using other public and individual health dangers such as alcohol and various recreational drugs. And these people need to be connected with part of public policies to individuals and groups that can help them. This is an example of a group called Empower. Again, you've got the World Health Organization warn people about the dangers, enforce bans, protect people from tobacco smoke, monitor it across individuals and groups. And this is something